Today we are going to discuss hypertension. Oh, this is an interesting topic. I don't talk about hypertension that much or that often with people, but it's actually an important topic. And friends, nowadays, if not every second person, then every third person has hypertension. Now, high blood pressure isn't just an issue for older people. Young people have it too. Oh. This is really interesting. And here, high blood pressure isn't cured. They treat it, but they don't cure it. But at the same time, it seems like they're treating it, prescribing pills. People keep taking these pills all the time. And yet there are still strokes, heart attacks, atherosclerosis, and chronic disturbances of blood supply to the brain. So there are tons and tons of problems associated with hypertension. And at the same time, as a doctor, I understand that treating hypertension with pills is the wrong approach. It's wrong. Well, have I piqued your interest yet? Hypertension is high blood pressure. But let's start from the very beginning. So we have the cardiovascular system. There is the heart, the engine, and the tubes through which blood is pumped. Arteries carry it out. Veins bring it back. These are the blood vessels. And inside these vessels is blood. And within the vessels, in the blood, there is a certain, let's call it blood pressure. There is a specific pressure in the arteries and a different pressure in the veins. It's completely different. And hypertension refers to elevated arterial pressure. What does it depend on? Why does it happen that inside the vessels the blood starts to increase the pressure? Is it because there's more blood? Interesting, right? Why does the pressure of the fluid suddenly increase in the vascular system in the pipes? What became the factor that raises the pressure of this fluid? Now that's interesting. Is there more blood? No. How can the pressure in the pipes, the pressure in our arteries increase? What can increase this pressure? In fact, to answer this question, you need to understand that our blood vessels are not just pipes. There is an outer membrane which is nourished. The inner lining is as smooth as possible so that the blood cells don't get damaged. And between the outer and inner walls, there is a muscular wall. Smooth muscle fibers. Smooth muscle fibers can contract and make the vessel's lumen smaller, or they can relax, making the vessel wider. And the pressure inside the arteries depends on the condition of the muscular layer of the arteries. By the way, this is true throughout the entire body. Not just in one place, but everywhere. Not just in the arm or leg, or in the torso, or in the neck, or in the head. Vascular tone, the tone of the muscular layer of the vessels, is present throughout the entire body. It determines what the arterial pressure will be. That is, if the muscular wall of the vessels, such as those found within the circulatory system, gradually contracts or tightens, the lumen of the vessels consequently narrows, and then the blood inside the vessels is further compressed, ultimately causing the arterial blood pressure to rise. So attention! It is important to note that an increase in arterial pressure can only take place in one case, as follows. Do you hear me? Only one. It is a spasm of the muscular wall of the vessels. That's all. All the other factors people mention, some say it's the head, others the heart, some talk about hormones, kidneys, and so on, or the thyroid. All these factors, yes, they do raise blood pressure, but they affect it through the muscular wall of the vessels. In other words, all the factors that are mentioned to you as causes of hypertension, causes of high blood pressure, are all factors that affect the muscular wall. And without it, nothing can be resolved. That's how it is. So this is the first point you should note for yourself, the muscular wall of the vessels. And now we are going to discuss which factors, by affecting it, can raise blood pressure. So we continue with the topic of hypertension. Friends, maybe I'm explaining things a bit more complicated right now, but I'm trying to speak slowly and articulate every word clearly. So, we've established that high, elevated blood pressure can only occur in one case, that is, a spasm of the vascular wall. And now, friends, take a look. A spasm of the smooth muscle fibers in the vascular wall, by the way, throughout the entire body, can be caused by neurohumoral factors. Neurohumoral factors. Let's translate that into plain Russian. It'll be easier to understand. Neuro means that nerve impulses from the autonomic nervous system can affect the walls of our blood vessels. Bear with me, I need to explain a little bit. There is the nervous system that lets me feel and move, that's the somatic system. The one that lets me feel and the one that lets me move. That's my nervous system, the one I control. And the part of the nervous system that I don't control, that I can't adjust, is called the autonomic or vegetative nervous system. The vegetative nervous system controls the functioning of the lungs, the heart, the thyroid gland, the stomach, and the kidneys. Basically, everything that I don't consciously control. I don't control my heartbeat, but it beats every second. And this vegetative nervous system also regulates the tone of the vascular walls. In other words, from the vegetative nervous system to, let's say, nerves go to our blood vessels throughout the body. The sympathetic nerve and the parasympathetic nerve. Let me explain in simple terms. The sympathetic nerve is the stress nerve. It constricts the blood vessels. The parasympathetic is the relaxation nerve system. It also relaxes the blood vessels. And the human autonomic nervous system regulates the tone of the blood vessels and, accordingly, blood pressure. If there is some kind of stress, it's necessary for the blood pressure in the circulatory system to be a bit higher, so that everything is supplied with blood, so that blood reaches everywhere. The sympathetic system kicks in, the sympathetic nerve constricts the vessels, the pressure rises, and I can perform heavy work. This is the adaptation system, the autonomic system. But that's the nervous part. And there's also the neurohumoral part. What is humor? It's a liquid, the fluid component. And this means that the tone of the vessels, the muscular wall of our vessels, is influenced by factors through the blood. These factors through the blood are hormones regulators. These hormones affect the vascular wall. So look, for example, adrenaline will affect the vascular wall. Adrenaline enters the bloodstream. The blood carries adrenaline throughout the body, the vessels constrict and go into spasm. The same thing happens with thyroid hormone. If there is a bit more thyroid hormone, like with thyroid problems, with hyperthyroidism, then blood pressure is elevated. Why? Thyroid hormone enters the bloodstream, there's a bit more of it, it spreads throughout the body, the vessels go into spasm, the vessels constrict. So, humoral factors are hormones that affect the body by entering the bloodstream, spreading throughout the body, and these hormones cause the vascular wall to spasm. Or let's take some kind of nitrogen compound. Nitrogen-based chemical agents cause the vascular wall to relax, right? And that's why various nitrogen-based medications, nitrates, nitroglycerin, for example, when these drugs enter our body, they also act on the vascular wall, but they cause it to relax. So basically, the vascular wall is influenced either by nervous factors, sympathetic or parasympathetic, or by humoral fluid factors, which can also either contract the muscular wall, causing an increase in blood pressure, or relax it, causing a decrease in blood pressure. But there is another factor that I haven't mentioned yet, and this factor is called angiotensin. I translate into Russian. Angio means vessels, and tensor means constrictor. So angiotensin can be translated into Russian as vessel constrictor. Ooh. Now this is getting interesting. What exactly is this vessel constrictor? Where is it? What does it do? How does it affect high or low blood pressure? Are you interested? We were talking about spasms of the vascular wall throughout the body. We discussed the factors that can cause this spasm or, on the contrary, relaxation. And now we've come to the topic of angiotensin. What is it? It's a special enzyme, a specific metabolite that is produced in our kidneys. And here we need to digress from the topic a little bit. Well, some digressions from the topic are necessary. So this is produced in the kidneys. What is a kidney? The kidney is the filter of our body. It thoroughly cleanses my body of salts and completely refreshes me. I call them salts, but to be precise, they are metabolic byproducts. Salts, let's just call them salts. Here are the salts. The kidney needs to clean out these salts, meaning remove them from the body. Urea, uric acid, various phosphates, oxalates, and other urates. Essentially, all these salts are metabolic waste products, like feces. They need to be removed. How are they removed? All of it flows and merges into the blood. Now look, Blood enters the kidney dirty, all this waste is filtered out, and the blood comes out clean. And all these salts dissolved in water are excreted from the kidney. This is called urine. That is urea, uric acid, urine. And the very first thing you need to understand is that the kidney doesn't just clean the blood by itself. Inside it, there is also a mechanism that controls the quality of its work, a quality control sensor. It's called the juxtaglomerular apparatus. You don't need to remember the name, but just hear it. A quality control sensor. And when the kidney is not coping well enough with its role of cleaning the blood, this juxtaglomerular apparatus releases the hormone renin. Ren means kidney, and renin is the hormone of the kidney. Renin immediately turns into angiotensin I, and angiotensin I into angiotensin II. Hold on a second. And then when angiotensin II enters the bloodstream, it causes spasms of blood vessels throughout the body. In other words, the renal factor, angiotensin II, which is produced as a result of poor kidney function, is one of the main factors that causes blood vessel spasms throughout the body and increases blood pressure. For what purpose? So that blood flows better to the kidney and the kidney works more efficiently. I hope I explained that clearly just now. It's important to understand this right now. In other words, by activating this quality control sensor mechanism, the kidney essentially raised the blood pressure for itself through vessel constriction and the release of angiotensin to sacs, and in this way the kidney is trying to function a little better. But we took a pill and lowered the blood pressure. There is a specific type of pill called ACE inhibitors or angiotensin converting enzyme inhibitors. These include enalapril, captopril, basically anything ending in pril like enalapril and so on. And also inalazid, which is combined with diuretics. These are medications that stop this process, or sartans, valsartan, Valsartan, Valsar and others. They are called angiotensin II receptor antagonists, which is even worse. In other words, these drugs, which are now considered the gold standard in treating hypertension, are actually agents that shut down this kidney mechanism. They shut it down, they prevent the kidney from functioning, they turn the kidney off. Guys, how can you tell? Let me explain. Look, once again, what is the function of the kidney? To cleanse the body, to purify the blood. And that's why the kidney excretes salts, which give urine its color. And when the kidney isn't working, I'm telling you, when the kidney isn't working, the urine is pale and clear. If I hear someone tell me, my urine is pale and clear, that means the kidney isn't working. The kidneys aren't functioning. Yes, you've been told that pale, clear urine is a good thing. It's actually very bad. It means the kidneys aren't working. In that case, all these salts stay in my body, in my joints and back. Stop. So in order for the kidney to function, it raises blood pressure on its own. But that's harmful. It's bad for the head, bad for the heart, bad for the blood vessels. There's pressure in the pipes, and those pipes are already many years old. Well, you have to understand, something could burst somewhere. And that's why we say, yes, high blood pressure is bad. It needs to be lowered. But when we lower the blood pressure, we are hitting the kidney, and after that the kidney shuts down and stops working. Check your urine after taking all these enalaprils. It's light and clear. That means the kidneys are shut off. There are several medications for, lowering blood pressure. But the most harmful among them are those that affect the kidneys, diuretics, ACE inhibitors, angiotensin receptor antagonists. These are the most harmful. They destroy the kidneys. I have been working with capillaroscopy for about 10 years now, and by looking at the capillaries, I can see how a person's kidneys are functioning. So those hypertensive patients who take these medications always have very poor kidney function. And then when the effect of the pill wears off, since the kidney is already functioning poorly, and after the pill it gets even worse, it raises the blood pressure even more. So it turns out that with these pills, we are not treating or curing high blood pressure, but only making the condition worse. And after taking these medications, the person feels even worse. That's why I always say that these pills are pills that destroy the kidneys. Essentially, when it comes to hypertension, there are two types of pills, those that destroy the heart and those that destroy the kidneys. Take your pick. Of course, both types are bad. But that's the mechanism of hypertension. The mechanism of high blood pressure is precisely that the kidneys are unable to sufficiently cleanse the body. They can't purify it. And so, in order to work at least a little bit harder, the kidney releases angiotensin, a vasoconstrictor. The blood vessels constrict and the blood pressure rises. That's it. Yes, there are humoral factors that can raise blood pressure without involving the kidneys. Things like stress, adrenaline, even thyroid hormone, thyroxine, hormonal and stress-related factors. When stress occurs, nerves, the sympathetic nervous system, blood pressure will also rise, but only for a short time. But the kidneys cause a stable, long-term increase in blood pressure. There you have the facts. This is the essence of hypertension. And this is the factor you need to understand right now. You can argue, try to prove whatever you want, but that's how the system works. So, how can we prevent hypertension? How can we avoid high blood pressure? What pills should you take? What needs to be done? Have I intrigued you? Well then, let's figure it out now. So we've more or less figured out why high blood pressure occurs and what role our kidneys play in this process. But how do we get them to function properly? Now let's get into that. But for each thing I'm about to say, it's important that you don't just hear it. You need to truly understand it. Then you'll be able to do it. And when you understand this and put it into practice, you'll get results. You'll cure your hypertension. So let's get started. The first thing you need to understand is that the kidneys cleanse my body with the water that I drink. Your health. Not with juice, not with compote, not with any other liquid, not with soup or broth, only with water. In other words, for the kidneys to be able to cleanse me, I need to drink water, pure water. Whether it's boiled or raw, those are just details. What kind of water? Those are details. The important thing is that it must be water. Let me warn you right away, many people don't drink enough water. How much water should you drink? Listen carefully to this number. It's impossible to say that everyone should drink 1.5 or 2 liters. Everyone is different. But understand the reason why. The kidneys need water to wash out all these salts from my entire body. That's why the amount of water you drink for your kidneys is determined by your weight, by a person's weight. So, for the kidneys to cleanse 30 kilograms of body weight, the kidneys need 1 liter of water per day. Is that clear or not? So, for a person weighing 60 kilograms, they need to drink 2 liters of water. That means if a person weighs 90 kilograms, they need to drink 3 liters of water per day. And what does can or can't have to do with it? This is the standard. This is the minimum that the kidneys need to cleanse you. And if you don't drink enough of this water, your kidneys simply can't cleanse you. And the process of releasing angiotensin is automatically triggered, which constricts the blood vessels and causes hypertension. From my observation, hypertension is a disease of people who drink little water. In many cases, simply establishing proper water intake is one of the most important factors by which a person's blood pressure just goes away. It's important that you drink enough water. That's the first important thing. You can argue or debate about this. I'll immediately cut off the question, what kind of water? Here, the quantity matters, not the quality. Listen to the quantity now. Only when you reach the right amount, like for a 90 kilogram person, that's 3 liters a day. Once you start consistently drinking 3 full liters of water every single day, then we can really begin to talk in detail about what kind of water it should be. Whether it's ionized, electrified, enriched with various charged particles, magnetized. I completely understand. That's also a factor to consider. But honestly, the quality of the water only truly becomes relevant if and only if you're actually reaching the necessary daily quantity. And as long as you don't drink water but drink half a liter or a liter, it doesn't matter what kind of water it is. It doesn't matter. It won't help until you reach the right amount. Now the second factor, you need to activate your kidneys. You need to activate your kidneys so that they start working. I need more blood to flow to the kidneys. I need to improve the blood supply to the kidneys. The simplest option. Well, no vasodilator medications will specifically improve blood flow to the kidneys locally. I'm telling you this right away. I have products made from turmanium ceramic. It doesn't really matter to me whether it's a mat or a belt. What matters to me is that the material it's made from is such that when heated, it gives off warmth, similar to my own body heat. I found Turmanium ceramic for myself. It is effective and always delivers results. People ask me, Dr. Volok, why don't you come up with something else? But why? It's enough for me. It provides a deep warming effect or warms deeply located organs. We take a product made of Turmanium ceramic and place it behind the person's back. When you place it behind your back, for example, while sitting, or you can lie on it, you position the mat, any Turmanium ceramic product, behind your back and set it to a sufficiently high temperature, so it heats up to 55 or 60 degrees. As a result of the heating, the body overheats, triggering the mechanism of blood vessel dilation, and then blood starts to flow better to the kidneys. Warm up your kidneys. Warm your kidneys for about an hour a day. About an hour. Usually this is most effective in the second half of the day, from 5 to 7 in the evening, for warming the kidneys. I'll say right away, the nature of your urine will change. It will become darker, more cloudy, sometimes small stones or sand may come out, but this provides a good cleansing for the kidneys. And when the kidney is activated, it starts to cleanse your body. Because the kidney is cleansing your body, the mechanism for releasing angiotensin stops working. And this creates conditions under which your blood pressure won't rise tomorrow. So this isn't just a treatment for hypertension. Warming your kidneys is necessary to prevent high blood pressure in the future. Don't expect that after warming your kidneys, your blood pressure will immediately go down. No. This treats the kidney and eliminates the possibility of hypertension in the future. But it's a vital factor. And there's something else I encounter as a doctor that I want to warn you about. First, start drinking water. If you start warming your kidneys but don't drink water, you'll achieve the opposite effect. Your hypertension will worsen and your blood pressure could rise all the way to a hypertensive crisis. Yes, I encounter this, but I don't want to drink water. I thought I'd drink it later. That's exactly the problem. So, first we drink water. The second factor, warm your kidneys. And the third factor, which is also the main one. As always, I save the most important for last. What's the main thing? Keep your feet warm. Attention. The health of your genitourinary system depends on how warm your feet are. It would take a long time to explain, and I don't want to do that in this video. But understand this, your kidneys are healthy and function well to the extent that your feet are warm. If your feet are cold, your bladder is unhealthy, your kidneys are unhealthy, and your reproductive organs are unhealthy. Your genitourinary health depends on how warm your feet are. Not just your feet, but your shins and thighs as well. And if your shins, thighs, or legs are cold, then to solve kidney problems or hypertension, you need to warm up your legs. You should always warm your legs using the same mat. Place the mat on a horizontal surface. Many people have varicose veins. With varicose veins, you must not warm your legs vertically. You need to warm them horizontally. You place your legs on the tourmaline mat. Once you've placed them, you also need to cover your legs so that they are heated from below and don't cool off from above. And you need to warm your legs. Usually this doesn't take long, 15 to 20 minutes, but it should be done every evening, evening after evening, every single day. In fact, you should warm your legs to the point where they start to sweat. Your legs should become covered in sweat. That will be the best kind of warming for them. But again, for some people this happens right away, for others it doesn't, but you should warm your legs every evening before bed, or warm your legs when your blood pressure goes up. Look, when your blood pressure rises, it's because your blood vessels have spasmed, and most of the blood has rushed to your head, but you warm your legs. What happens to the blood vessels in your legs when you heat them up? Yes, they dilate. The blood flows to your legs, and your blood pressure decreases. Warming the legs is an old method for lowering blood pressure, for saving a person from apoplexy. Do you remember what apoplectic stroke is? That's what a stroke was called in the 19th century. And hypertension didn't have that name yet back then, but it already existed. So how did they help people? They put their feet in hot water. A paramedic would arrive, see a hypertensive crisis, the blood pressure extremely high. Immediately feet into hot water. Even if the blood vessels dilate just a little, the blood pressure will already go down. Warming the feet is an old-fashioned, non-pharmacological way to lower blood pressure. Not as much, not as quickly, not for everyone, but it is a factor. And for me, I don't even need to warm my feet to lower my blood pressure right here and now, like solving a hypertensive crisis, but rather to improve kidney function. Because if you start warming your feet, your kidneys will become more active and prevent you from having high blood pressure the next day. That's why this approach not only treats, but can actually cure hypertension. Here are 3 factors necessary to cure hypertension. Here's today's advice from Dr. Golod. Drink water, keep your kidneys warm, keep your feet warm, and you'll solve your kidney problems and your hypertension problems. Pills? Don't take pills constantly every day. Solve the problem of hypertension. When your blood pressure goes down, you simply won't need those pills anymore. But it's very harmful when a doctor says, take pills all the time, even if you don't need them. That's the wrong approach. Hypertension is about the kidneys. You need to get your kidneys working. Drink water, keep your kidneys warm, keep your feet warm, get your kidneys going, and your blood pressure will stop rising. You simply won't need pills. That's the most correct approach. Today's information for you from Dr. Golod was about hypertension. Guys, write in the comments if you have any more questions, whether about this topic or another one. We'll keep communicating, we'll keep figuring things out together. My, let's say, goal is to bring you information so that you stay healthy. Well, that's the information I had for you today. Thank you for your attention. I'm always here with you. Dr. Golod Volodymyr Miroslavovich. Goodbye, friends.